Hello, my name is Natalia Camejo. I am medical oncology in Hospital de Clínicas in Uruguay. I present the study effectiveness of trastuzumab for HER2 positive breast cancer in a real-life setting. Trastuzumab was shown an overall survival benefit in patients with HER2 positive breast cancer, both in adjuvant and metastatic setting. However, there are doubts as to whether the result for clinical study can be directly translated to regular clinical practice. We are especially interested in determining the survival rate of patients treated with trastuzumab no longer in a clinical trial, but in a real life. Uruguay was a universal health coverage for its entire population, including high-cost drugs, which had been provided by the National Resource Fund, FNR, since 205 under coverage protocols. In 206, trastuzumab was incorporated into the coverage of FNR for treatment of breast cancer, with the aim of obtaining results similar to those reports in the recent clinical trial that demonstrate clinical benefits. The FNR coverage protocol established selection criteria and methods analogous to those included in the pivotal trial. It is important to know the characteristics and evolution of patients treated with trastuzumab, based on the regulation established by the FNR. The current study provides useful information to assess the coverage protocol of trastuzumab in HER2 positive breast cancer in our trial. To estimate the overall survival of Uruguayan patients with HER2 positive breast cancer treated with trastuzumab provided by the FNR between 206 and 216, globally and according to disease stage and treatment modality, adjuvant, neoadjuvant, or metastatic setting. We conduct a prospective study of a cohort of patients with HER2 positive breast cancer treated with trastuzumab under FNR coverage approach. The data gathered was age of diagnosis, status and hormonal receptor, menopausal status, TNM stage, trastuzumab treatment modality, date of death or date of last follow-up. Two subtypes were defined: HER2 hormonal receptor positive, HER2 hormonal receptor negative. The Kaplan-Meier method was used to the statistical analysis, and the difference in survival between groups was evaluated using the long-range test. Patient anonymity was maintained in the analysis, and the study was approval of the Research Ethics Committee of the School of Medicine. Result: 1,945 patients were included. The median age of diagnostic was 32.8 years. 1,085 patients was postmenopause, and the rest was premenopause. 153 present initially with a node positive axilla. 1,214 patients was HER2 positive, hormonal receptor positive. 619 was HER2 positive and hormonal receptor negative. Trastuzumab was administered as adjuvant therapy in 1,209 patients. As neoadjuvant and adjuvant therapy, to 263 patients, and for advanced disease to 319 patients. At the median follow-up of 44 months, survival for stage 1 to 3 was analyzed according to treatment modality. Overall survival at 5 years was 86% for patients who received adjuvant treatment, 70% for patients who received neoadjuvant treatment. With regard to patients with advanced breast cancer, the median survival for 25 months. The comparison of the survival curves for patients with the stage 1 to 3 breast cancer according status hormonal receptor was shown significant difference only for patients with stage 2 and stage 3. Conclusion. Our study results are not inferior to those reported in clinical trial, but in adjuvant and advanced disease setting. Important, these results support the relevance of the feasibility of treatment patients in routine practice following coverage protocol based on patient criteria and methods supported by positive clinical trial. Thanks.